Life for me with urgency incontinence is a constant awareness of my bladder, this constant fear of wetting my pants, to put it bluntly. And I have so many triggers. Not only am I aware of my bladder, but I have so many triggers throughout the day. For example, brushing my teeth. I often have to set my toothbrush down on the edge of the sink and head to the toilet. When I'm washing my hands at the sink in the kitchen, I have to run to the bathroom. Doing laundry. When I get ready to start the clothes washer, I haven't even started it yet. But knowing that the water's going to start running, it's an automatic trigger. I have to head up the stairs. We tried Kegel exercises, didn't work. We tried biofeedback. I worked hard at it. Didn't work. We used medications, I think 4 or 5 of them. None of them worked.
Today we were able to place a test stimulation lead into Loraine. We got appropriate sensory responses. She felt it in the right places. It was comfortable. We had appropriate motor responses. The correct muscles moved when we stimulated, and on the x-ray image there did appear to be a good positioning of the lead. So when all those things come together, it means that it's a good opportunity to try the stimulation, and we'll see over the next several days how the stimulation impacts her symptoms.
Today's the 5th day after my implant. I'm feeling terrific. I feel like I'm back to normal with regard to voiding. In fact, my bladder diary reflects that. I've had no incidents of leaking. Even today, I was brushing my teeth, and I didn't have to stop and lay the toothbrush down and run to the toilet. This is the first load of laundry I've done since the implant. So we'll see what happens once the washer starts. The setting is all right. Change it to cold. This is when it usually happens. Nothing.
Hi Loraine, how are you?
Just fine, thank you.
Nice to see you. What has been the biggest change that you've noticed?
Well, I haven't had any leaks.
It was 0?
0 leaks.
Wow, that is huge. Mm-hmm. So looking at your diaries, the average amount that you were urinating was about 130 cc's, or 4 ounces, 4 1/3 ounces. And now you're voiding 330 cc's, which is about 11 ounces. Mm-hmm. So much bigger volume, and it goes along with the decreased frequency. So I think that how you feel and what those diaries indicate show that you are a good candidate for the chronic implant, and we should go on to that at this point.
Thank you.
Oh, sure, you're welcome. I'm really glad. It makes me feel great when I have a patient like you who I know I've been taking care of for a long period of time, and who we haven't been able to make better with the other things that we tried, that this works.
This therapy is not for everyone. Talk to your doctor to determine if InterStim therapy is right for you. The therapy is completely reversible and may be discontinued at any time. As with any therapy, InterStim therapy is not without risks. In addition to the risk related to a medical procedure, complications from this therapy can include pain, infection, transient electrical shock, lead migration, and adverse change in bowel function, among others. These complications were generally resolvable in the clinical study.